Diabetes was listed as the seventh leading cause of death in the United States. In 2010, the Institute for Alternative Futures predicted that by 2025, diabetes would have an increase of 64%. That translation is about 53 million Americans could be living with diabetes by the year 2025. 2012, cases of diagnosed diabetes cost the U.S. an estimated $35 billion. Standard & Poor's has estimated the annual market will hit $58 billion in expenses by 2018. If the Institute of Alternative Futures is correct in their predictions, this increase could result in annual medical costs exceeding $73 billion by the year 2025. In adults older than 20 years old, more than 1 in 10 suffer from diabetes, and in seniors 65 years and older, 1 in 4. 1.7 million new cases of diabetes were diagnosed in U.S. adults in 2012. Men have a slightly higher risk of developing diabetes than women. Some of the causes are excess weight, especially around the waist. Family history. If one parent suffers from diabetes, your risk of increases to almost 15%. If both parents have diabetes, your risk increases to 75%. Now this is diabetes type 2. Lack of exercise and poor diets are significant risk factors for this illness. You need to do some exercise, walk around, don't take the elevator, take the stairs. If there's a stairs next to the escalator, take the stairs. Type 2 diabetes, of course, is more common and increasing prevalent illnesses that is largely preventable. Adults with type 2 diabetes accounts for about 90% of all diagnosed cases. The remainder are adult onset or adult diagnosis type 1. The cause of type 1 diabetes is unknown. You're born with it. Weight loss and increased physical activity reduces development of diabetes type 2 by about 58%. During a 3-year study, older subjects 60 years and older that lost between 5 and 7% of their body weight had a reduction in diabetes type 2 by 71%. Overweight individuals, again, who lose between 5 and 7% of their body weight through exercise and healthy eating may effectively prevent or delay the onset of diabetes type 2 indefinitely. Certain ethnic groups in the United States have higher rates of diabetes than others. Type 2 diabetes is more prevalent amongst Native Americans, African Americans, Hispanics, and Asian Americans than among Caucasians in the United States. Much of that is due to the diets. Asian Americans have a 9% higher risk of diabetes than Caucasians. Hispanics have a 12.8% higher rate of diabetes than Caucasians. Non-Hispanic blacks 13.2% higher than Caucasians in the United States. Type 2 diabetes increases with age. Although the number of children diagnosed with type 2 diabetes is increasing due to the growing number of overweight youth, we need to get back to that 30 minutes of exercising a day. Let the kids run around outside. It will really help prevent the onset and increase of diabetes among the youth. Early identification of potential complications can provide opportunities for intervention, education, and referrals to specialists. Okay, most will tell you that an active child has a less chance of contacting or having diabetes 2 than those that sit around and play games all day on the internet or their video games. Individuals with diabetes are twice as likely to suffer from depression compared to those without it. The World Health Organization states that 50% of people with diabetes die of complications such as cardiovascular disease and stroke. A pregnant diabetic woman increases her chances of having a baby born with birth defects than a non-type 2 diabetes pregnant woman. The drug metformin was found to reduce the risk of diabetes onset by 31%, particularly in younger ages 25 to 44 adults and heavier adults with a body mass index of 35% plus. The question is, why am I telling you this, and what can you do as an individual to help control your diabetes? Let's first address the issues of medications, okay? Insulin and other diabetic medications are designed to lower your blood sugar. And when diet and exercise alone aren't sufficient for managing diabetes, these insulin-type medications will help. People are becoming more aware of their blood sugar levels as diabetes is becoming more and more talked about and more recognized as one of the leading causes of death in the United States, as I had mentioned earlier. So what do? We got to store insulin properly. Insulin that's properly stored or past its expiration date may not be as effective. Insulin is especially sensitive in extreme weathers, both hot and cold. Deal with your doctor, talk to your doctor, discuss what's going on, okay? If your diabetes medication causes your blood sugar levels to drop too low or is consistently too high, the dosage or timing may need to be adjusted. If your doctor can't get you in to discuss this, talk to your pharmacist. They're quite familiar with your medications, more so than the doctor sometimes. Be cautious of new medications. If you're considering an over-the-counter medication, or your doctor prescribes a new drug to treat another condition, such as high blood pressure or high cholesterol, ask your doctor or pharmacist if the medications may affect your blood sugar levels. Liquid medications may be sweetened with sugar to cover their taste. Sometimes an alternative medication may be recommended. Also check with your doctor before taking any new over-the-counter medications so you know how it might affect your blood sugar. What about when you're sick and you're traveling? When you're sick, your body produces stress-related hormones that help your body fight the illness, but they can also raise your blood sugar levels. Changes in your appetite and normal activity may also complicate diabetes management. What should you do in this situation? Plan ahead. Work with your healthcare provider, your nurses, your doctors, your pharmacist. Okay, to create a sick day plan, if you will. Include instructions on your medications so family members can also assist. Continue to take your diabetic medication. However, if you're unable to eat because of nausea or vomiting, contact your doctor. In these situations, you may need to adjust your insulin dose or temporarily stop taking your medication because of a risk of hypoglycemia. Stick with your diabetic meal plan. If you can eat. Eating as usual will help you control your blood sugar levels. Keep a supply of foods at your desk if you're running around or you're working, okay, which are easy on your stomach, such as gelatin, crackers, soups, and applesauce. These are also very easy to carry in your purse or your work bag or your backpack. Drink lots of water and other fluids. Staying hydrated also helps. Okay, if you're taking insulin, you may need to sip some sweetened sugar drinks. That keeps your blood sugar from dropping too low. An organization called Taking Control of Your Diabetes, a not-for-profit group dedicated to informing and empowering people with diabetes to become actively aware in their own health care, concluded that many people with type 2 diabetes receive a significant amount of education on diabetes management. However, several factors, including economic constraints, are restricting them from translating this knowledge into actionable steps, which can lead to serious health risks. This is where my organization, the New York RX card, New Jersey drug card, Massachusetts drug card, and Connecticut drug card come into play. Our program is a point-of-sale discount that provides you with discounts as high as 75% on your prescriptions at the point of sale. This program has no requirements. Everyone is eligible regardless of age, income, current health condition, residential status. It is not designed to lower copays if you have insurance, but it will discount prescriptions not covered on your plan. There are times when our discounts on certain medications will be lower than that of your insurance. Okay, if you have Part D, the way our program works with Part D is that we'll discount prescriptions that are not covered on your plan, as well as discount prescriptions that are not discounted when in the donut hole. Okay, some of the common medications out there with diabetes that help fight diabetes or control your diabetes have discounts as high as 60%. There are some new medications that are coming out. Our discounts range anywhere from 13 to 28% on these medications. There's a helpful, if you have internet access, there's a helpful tab on our website called the Medication Pricing Icon, which can be located at NewYorkRxCard.com. You enter in your medication, you enter in your zip code, and it will let you know which pharmacy in your area has the lowest discount on that particular medication. Okay, there's no questions. Everyone is eligible. It's honored at more than 58,000 pharmacies nationwide. There's a lot of new competitive medications that are coming out in the next year to help combat and lower blood sugar levels with diabetes type 2. Lantus is the undisputed king of the diabetes drug category. Lantus 10 milligrams has an average retail price of $311 across the nation. With our discount program, you'll pay as little as $193. It's a significant savings of about 28%. Okay, Januvia 50 milligrams has an average retail price of $407. Our program provides an 18% discount on average, lowering that price to $334. It's quite helpful if you don't have insurance. Okay, this program is also good for anyone that you know, friends, relatives, even your family pet. Tresiba is a long-lasting drug introduced by Novo Nordisk, who are here today. They'll be telling you more about this prescription later on in their presentation. It claims to have a 40-hour life, unlike other medications within this category of 20 to 24 hours. 40 hours. The average price is about $457. We provide a 28% discount on average on that, lowering your cost on that medication from $457 to about $318. Again, a significant savings. Farxiga, I don't know if I'm pronouncing that properly, has a significant price discount. $300 is the average price. With the New York RX card or New Jersey drug card, lowers it to less than $20. Okay, now that medication has been around for some time, so the longer a medication is out on the market, the greater the discount's going to be through our program. Any questions?